Treating TMJ or jaw pain when your night guard or customized orthotic for the jaw hasn't worked. If you don't know me, my name is Dr. Chad Schaefer. I'm a physical therapist and TMJ specialist here in Troy, Michigan. And let's just get right into it. So a lot of the people that I work with on a daily basis have had a night guard. They've had the customized orthotic where it's adjusted every couple of months or every week, whatever the case is. But the problem is they're still having pain. So it kind of begs the question, what is this really doing for people or patients? So the night guard, if you don't already know, the night guard is essentially, you've got your temporal bone of your skull and your condyle, your jaw below it, and in between is a disc. And the night guard is supposed to cushion that a little bit just so you don't get excessive amounts of compression and grinding, bruxism, if you will. And that's kind of the night guard, and that's the rationale behind it. The other part is the customized orthotic is supposed to essentially change your bite or your occlusion, or how your teeth meet when you bite down. And again, it's adjusted based on how your bite changes over time, and it's supposed to help you with your jaw pain or help to solve it. Well, a couple problems with both of those. There's a kind of a fallacy or a lack of logic in that thinking, because you were assuming that the only cause of TMJ and jaw pain is because of excessive compression or because your joint is quote unquote off, your bite is off. Well, a lot of times, a lot of people that I work with they have that same story. They've had a night guard, they've had a customized orthotic. A lot of people have dealt with it for months to years, and they're still looking for answers. They're still on Google, they're still looking on YouTube, whatever the case is. So again, the lack of logic is assuming that the jaw is the only pain generator. I'm here to tell you that we know through evidence and through research that the jaw is not the only reason that you can have jaw pain or TMJ problems. It's obviously included, but we know that the position of the head and the neck, the cervical spine, when our head is more forward, it places our jaw in a retruded or backward position, which can predispose you to maybe open locks, closed locks, or it can predispose you to the clicking and the popping that a lot of people get. Even if your head is off to one side, if you're having pain, you're having a sensation of tightness, that can alter the TMJ mechanics. Stress is a big component of it. Breathing, how you breathe, your upper thoracic spine, your shoulder, the lower lumbar spine, those all play a role in how you experience it. If you experience TMJ pain, it's not just you're a jaw and let's treat the jaw. We have to open our lenses a little bit and say, well, how's the neck moving? The neck not everyone's neck has to be perfect. That's not what I'm saying, but you have to at least examine the neck, look for some restrictions, and then the best way to do it, the best way to treat the neck or the upper back and see if it helps the jaw is to do that exact same thing. Let's move your neck around. Let's do some joint mobilization. Let's push on that. Let's see if this is mobile or hypomobile, and let's repeat a motion and see if that makes any change in pain. That's the best way for me to tell my patients if it's going to work for them, and it can be different from person to person. So instead of giving you blanket advice saying, do this one exercise, it's going to help you, it doesn't always help everyone. Sometimes one thing makes somebody worse and another thing makes somebody else better. So it's very dependent from person to person. It's very unique. So that's kind of the spiel on why a mouth guard or a night guard or even a customized orthotic may not be helping you with your jaw pain. And I think it's a big problem because I've seen this tons and tons of times that they've been told that it's just their bite. And what that does is it ramps their nervous system up, and it says, my bite's wrong, I gotta have it fixed. And now you're having it fixed for years, and you gotta wear a customized orthotic for the rest of your life. To me, that's, sometimes if it helps with jaw pain, if it's part of the solution, great. But if we're not addressing everything else and how the body perceives pain, I think it's a big problem. So thanks for tuning in. Again, my name is Dr. Chad Schaefer, physical therapist and TMJ expert here in Troy, Michigan, and have a great day.